Yate, Chigedo, Shidnando, Nahokat, Nani, Kliniki, Hode. Our journey was bittersweet. My grandson, HT, was born with Artemis-SCID, meaning he had no immune system. And I've seen him going through a lot of pain. But after HT went through the Artemis clinical trial, he's living a normal life now. He's paving the road for the newborns with SCID.
The very first patient that I saw when I was an intern at UCSF was a child from the Navajo Nation with severe combined immunodeficiency disease. And I think that very first experience had a tremendous impact on me. I'm Dr. Morton Cowan, and I'm the principal investigator of this clinical trial for patients with primary immune deficiencies.
Morton Cowan and I have had a lifelong desire to help advance treatments for people with immune deficiencies and to bring the best care to every corner of the globe.
Artemis-deficient SCID is considered to be the most serious of all primary immune deficiencies.
Artemis has only about 50% survival, and that's what led Morton Cowan and me to think hard about better ways to treat SCID. And we were able to do this with gene addition therapy.
SCID in general is the absence of a certain part of the immune system. And when you don't have those cells, then you're very susceptible to a whole variety of infections.
Their infections just accumulate and become more severe until they actually can't survive.
This disease, it's common on the Navajo reservation. And after HT was born, my daughter-in-law, Angela, called us saying that they need to take HT back to the hospital. There's something wrong with HT, that he needs to be isolated right away.
We got a call from the doctors in Tuba City that there was a patient, a baby that had Artemis deficiency. And we offered the possibility that we could use gene therapy rather than a bone marrow transplant.
A different kind of treatment where we would actually make the patient's own cells corrected. And that way they wouldn't be rejected.
Dr. Puck and I set up a conference call with them
and presented what we could about this trial.
And that why we thought it would be better than a standard bone marrow transplant.
So we sat down, we talked about it, and we agreed that, we'll go with UCSF.
They agreed to be pioneers in this study. They really have led the way.
They were willing to enroll him as the very first human ever to receive this treatment. HT is really a pioneer.
We knew what we hoped would be the outcome, but it doesn't happen immediately.
I arrived June 1st, and I didn't leave his room until October. And I prayed until it was done.
And after we took the first blood sample to see if there was any evidence of gene-corrected cells, and lo and behold, we saw them.
It was all very exciting because he was the first patient and these were the first gene-corrected cells. We've been extremely gratified to see their immune systems have improved. And not just improved, but actually become normalized in many of the cases. They're all at home, they're all healthy, and you can go to school and you play in the dirt and not have to worry.
HT is so fortunate to go through the gene therapy. He's not sick anymore. He discarded all of his medication. He's happy and he's growing to be a young man.
We're pioneering gene therapy in this very rare disease right now, but we are using techniques that can be exported to other situations and can help many other conditions worldwide. That's, to me, what UCSF is all about. Doing the best research, but not stopping there, and opening the doors of the lab and bring it to all community. And every new innovation happens one patient at a time.